so began a long line of misunderstanding that could not be more prevalent than in healthcare and in this room today. Before we learn about best practice resource, please allow me to share with you a personal worst practices. This is my dad, Jerry, and my two boys, Micah and Luke. I have been trying to get my dad to live healthier, see his doctor, and quit smoking for 20 years. He wasn't having anything to do with it. Perhaps as revenge to the fact that I didn't listen to him growing up, I'm not sure. He would oftentimes say, I don't need to go to the doctor. I only need to go to the doctor when I'm sick, and I don't get sick. Sound familiar? Just like your employees are saying. The good news is, my dad is fine today. He lives a pretty healthy life. He quit smoking, and he even sees his doctor. The challenge for his company, however, is in the last 5 years, he has accumulated $360,000 in cardiac expense alone. His prescription bill is $1,400 a month. As much as my dad would love to retire, he's 67 years of age, as much as my family and I would love to have him retire, that's not going to happen because he loses that prescription coverage. He can't retire. That's the challenge for him as an employee and as his employer to cover that expense. You see, I failed to help my father understand the difference between health and medical. And there's a big difference, isn't there? You've already learned that 95 to 99% of your healthcare expenses are going towards medical, not health. Your first challenge today is to champion health over medical. Because make no mistake, if you do not champion health, it's going to become medical. That's why your health costs are going up by 11% a year. Keep that in mind when you're contemplating, when you're planning, when you're budgeting, even a comprehensive wellness program that probably costs less than what you're spending on wasted copy paper or watering the plants. Did you come excited today about the prospect of learning more health information? That was a trick question. The answer is no. Isn't there too much as there is now? There's too much information. Nobody wants more. But don't most people want better health information? Gone should be the days of 90-page medical claims reports and 15-page health risk appraisal reports. Nobody understands them anyways. That's not actionable. We started with the Michigan Cardiovascular Business Alliance project, as we oftentimes do, in helping clients boil down this tremendous ream of information into actionable data. And we like to start with healthcare costs. So we simply ask, how much are your bottom line medical payments every year? This particular client executive thought that they were spending $10,000 a month. So we helped them go through all of that data, confusing as you can imagine, and found out that they're spending more than $100,000 a month. This is a corporate executive. And they're a very astute corporate executive. It's very common. This information is getting hidden in plain sight. Healthcare, for example, has become like a remote control that has so many buttons, no one knows how to change the channel. Your second challenge today is to change the channel. Change the healthcare channel using effective best practices. Some best practices you may want to be aware of include the checklist for successful heart disease and stroke prevention, something done by the Michigan Department of Community Health. This is what we started with in this project, assessing cardiovascular health, one of Dee's clusters, as you mentioned. He called it biometric. Heart attack and heart disease and stroke prevention is a very good place to start because it's costly and it's also very dangerous. It will give you an opportunity to evaluate best practices versus your actual corporate benefit structure as to how well you're providing preventive health versus cardiovascular medical health. You'll also want to be familiar with the evidence statements for clinical practice benefit guidelines. They have evaluated 46 benefits and asked you to consider covering them as part of your benefit plan. For example, an abdominal aortic aneurysm, otherwise you may know known as a AAA. It can be a very deadly condition where the vessel in your abdomen becomes inflamed and it can burst and you can die. Even if you don't die, the typical medical hospital expense is $92,000 for a AAA. A test to screen for a AAA costs an average of $140. So my question to you is, should you consider paying for AAA screening on every one of your employees? Maybe, maybe not, but that's where the beauty of these evidence-based statements are, because they actually help you dial down targetedly who needs those benefits. For example, women are at much lower risk of having a AAA. Smokers, on the other hand, are at much higher risk of having a AAA. So can you see the beauty of these evidence statements, and to ask you to consider paying 100% first dollar coverage for AAA screening for every male that has smoked in your company. And so it goes for all 46 of those preventive service recommended guidelines. One of the most striking conclusions that we reached from this project was that nobody knows this. We actually felt unqualified to evaluate benefit plans because we're more of a health ROI or wellness provider. And we dug into this and we studied the evidence statements and found out that nobody's providing these services for companies. And companies were saying that, why hasn't anybody ever done this before? Because we think, as health professionals, that the benefit firms are doing it. The benefit firm thinking that somebody else is doing it, and nobody is doing it. This is a tremendous opportunity for you right here. What else? D talks about how much he likes to annoy people, doesn't he? He's pretty good at that sometimes. I say that with the utmost respect. One of the ways you can get back at D is to ask him about wellness on a shoestring. Boy, does that get him angry. Because it doesn't work. You get what you pay for, especially when your healthcare costs are already skyrocketing. One of the single most dramatic exceptions to that rule I've ever seen in my entire career is in the Michigan Department of Community Health. Working with them for almost 15 years, I've never found a resource from them that is less than exceptional. They find the best resources in the country. They boil them down into actionable strategies for you, and they're free. It really is too good to be true. You should be very thankful that they're not competitors of yours. They're here to help you. Take advantage of their resources. Their health risk appraisal, their designing healthy environments at work, cultural survey, their health interest survey, all of the resources are no less than phenomenal. If you're interested in additional resources, or if you'd like Christy or myself to follow up with you, we'd like to make it easy for you to do that. First of all, there's a clipboard that Christy's going to pass along. If you would like to put your email address on that clipboard, we'll make sure that we get to you industry-leading trends, tips on how to avoid the most common mistakes, and some ROI scorecards that have come out as a result of this project. Not too long ago, a Stanford psychologist studied and played a game in which she divided people into two groups, either tappers or listeners. Tappers were given a list of highly recognizable songs, like Happy Birthday to You or the Star Spangled Banner. And they were instructed to tap that song out to the listeners using just their hand on the table. Listeners were instructed to guess the song that the tapper was tapping out. Interestingly, as a result of this experiment, was that listening is a very difficult job. Listeners were only able to guess the song 2.5% of the time. Tappers, on the other hand, were incredulous. They couldn't believe that listeners could not guess that song because it stuck in their head. Isn't that what's going on in healthcare today? Try it sometime. If you're a tapper and you're tapping out Happy Birthday, you don't understand what it's like not to have that song in your head. Did you hear it? But to a listener, it sounds like garbled Morse code. Your third challenge today is to tap simply and effectively. There is a wealth of amazing information available to you. The burden of proof has been met, but we are not very good tappers. Because again, you don't understand what it's like to have all of this information that doesn't make sense to most people. For example, D. Eddington's book, Zero Trends, is thought-leading. It's groundbreaking. All of you should read it. It's also 191 pages. How many executives or decision makers are going to read that? You're going to take that information and it's going to go into your song in your head. You need to use your own personal experience to let that out. This toolkit and these evidence statements are revolutionary. I think it's one of the biggest opportunities for you in healthcare today. It's hundreds of pages. You need to tap this simply and effectively so that your clients and your employees can put this into practice very actionably. That's the challenge. Could you see how D's scorecard boils down to two what seem to be simple metrics? Percent low risk participation, percent low aggregate risk and percent participation. Sounds simple, doesn't it? But can you imagine how much research goes into that? That's where your opportunity is to tap simply and effectively. When we're providing our zero trend appraisals or our ROI scorecards to our clients, all of our information is on one page maximum. And it has to be actionable.